We'll start with two case presentations. Two dear and very courageous members of these panels, Lucien Laor and Uri Levine, will present their clinical work. Afterwards, we will invite the panelists, Dr. Rina Lazar, Dr. Miriam Berger, Professor Eshkol Rafaeli, and Professor Lou Aron to discuss the case presentations. We hope that we'll have a real talk and conversation between the panelists and the presenters. And immediately afterwards, we'll open the discussion to the audience. We have two case presentations. Each is planned to take 20 minutes. Lucien Laor will present a case of individual therapy, and Uri Levine will present a case of a group therapy. So I would like to thank in advance Uri and Luci for their courage to present their case, and I hope the audience, although tired, excited, full of ideas, will find the attention needed to help them to hold the energy needed to present the case. So we'll start with the individual case presentation. I would like to present Dr. Lucien Laor, the chief head psychiatrist of the Israeli Intelligence Corps. He has graduated the psychotherapy program at the Sackler Faculty of Medicine, Tel Aviv University, and is now studying at the relational track of the psychotherapy program. Luci.
Okay. First of all, I'm very excited that I was invited to present a case here, and I will try not to take a lot of time and say that I will just put myself in your hands and make myself as vulnerable as possible. So, I want to share with you today some of my clinical work with a patient I call Gil. This is an ongoing treatment, which is now in its second year, and mainly Gil felt sad and despondent from the beginning of his military service, some 6 months before we met. During that time, I served as a psychiatrist in the IDF Intelligence Corps, and Gil was referred to me by the mental health officer in his base. It might be of importance to state that my main practice consists of psychiatric evaluation and supervision of mental health officers, but I maintain a regular amount of psychotherapies which are usually referred to me and chosen by me. I work only in the military, and I do not have a private practice. This constellation makes my psychotherapy patient chosen patients, as I choose all of my patients. Gil was 24 when we first met, and he had just finished his officer's course and related his uneasy feeling about his familial constellation. Just before starting his military service, Gil had finished his BA in physics and mathematics. While he studied at the university, he lived alone for the first time in a rented apartment. Upon his return to the army, he had to move back to his parents' home. Being gay, the return home intensified the separateness-relatedness conflicts in his family. Gil had not disclosed his gay identity to the family, but was actively dating, a situation that forced him to make up excuses for his disappearances. His parents, being quite controlling, demanded to know his whereabouts while he continued to lie to them, thus creating a vicious cycle in which Gil's parents try to control him while he tries to separate and disengage from them more forcefully. We started a once-a-week session psychotherapy. He always arrived on time or ahead of his time, never missed an hour, and was totally committed to the process. During our first meeting, I was impressed by Gil's stature. He rose to the height of about 2 meters, and I felt small next to him. His height and personality filled up my tiny room and created a sense of density and physical proximity, which I occasionally found very uncomfortable. I was always aware of my body and posture, and I could feel Gil's scrutinizing look as well. As time passed, I came to realize that my sensitivity and over-awareness stemmed not only from his impressive physical and mental presence in the room, but also from his sensitivity and hypervigilance. Gil read my mental states very well. He knew exactly when I was interested in his words and when I was not. The slightest shift of my gaze was usually followed by quite accurate remark on my mental state. This created a state in which both of us were very sensitive to each other and were on guard, so as to catch the other failing or being out of tune. Gil was the third child of 4 children and the only son in the family. He was raised in a small town in central Israel in a lower middle-class conservative Jewish family. His 2 older sisters had been married, and the older one had 2 children of her own. As the only male child in a conservative family, he was expected to get married and settle down. If before his sister's marrying he felt that he was the preferred child, he was overthrown from his special status after that. He felt that his parents paid more attention to his nephews and brothers-in-law than to him. This made him feel neglected on the one hand and guilty and ashamed on the other hand. His parents provided him with a stable and caring environment, but had difficulty allowing him to separate from the family. They were hardly controlling in this regard and tried to find out his whereabouts. A similar pattern of good therapeutic alliance and trust developed quickly between us, with issues of control and autonomy pervading our relationship. I want to share with you briefly 3 moments of what I think are empathic failures or enactments that will lead us to the clinical vignettes I will present shortly. The first interaction occurred shortly after the beginning of treatment. I told Gil, as I do routinely with new patients, that we will meet several times to see how compatible we are and decide together if to go on working together. After about a month and a half, Gil asked me if he passed the trial period. I have to say I was amazed. I did not think I put him on trial, and I assumed the answer to that question was clear to him as it was for me, that our meetings will, of course, continue. We came to understand Gil's assumptions as him needing me to confirm my commitment and responsibility towards him, and my avoidance of referring to the question specifically as preserving my privileged position as the omnipotent or grandiose therapist. The second interaction occurred when I tried to inquire into Gil's reason for seeking treatment. I believe that part of the reason in asking that question refers to me being a psychiatrist and working in a public military setting. But there were counter-transferential reasons as well. Gil read this inquiry as me not wanting to treat him, while I think I overvalued his strengths and devalued his difficulties as well as my ability to help him. On a deeper counter-transferential level, I believe I identified deeply with Gil, being gay, academic reserve officer in the military, and serving in a highly regarded unit and position myself. I allowed myself to identify with his competence and dissociate his and mine dependence and neediness. The third period followed the duration of a month in which Gil complained of moderate depressive symptoms. I noticed the symptoms but continued to listen analytically. I avoided diagnosing him or offering him medications. But because I did not think he warranted such an intervention, and maybe part because I tried to split my psychiatric self-state out of the room, this interaction could be further seen as a repeated thematic dissociation of the competent and powerful self from the incompetent and needy self. At the end of the period, Gil boldly asked me if I knew how to diagnose depression. Hearing that question at first, I did not know whether to laugh or to cry. I felt an ascension of narcissistic rage. Who are you to question my diagnostic abilities? Do you think I do not know how to diagnose depression? This is what I do every day. I thought to myself, don't you know how hard it is for me to offer you medications, not to diagnose you? After a period of self-containment, I interpreted the enactment along the lines of dissociated, competent, and needy self, took responsibility over my empathic failure, or not noticing his difficulties and needy self. And I will now move on to the clinical vignette. It's an hour. Gil phones me a day prior to our scheduled meeting and asks me, what time are we supposed to meet? Since he was in a course, we needed to adapt our schedule a bit. I replied that we are meeting at the regular time. He arrives on time. Do you see that? Yeah, okay, so it's... How is everything? Smiles. I smile back at him. I am still upset by our last session. We said we will continue from where we stopped. Do you remember what happened? Can you remind me? I say to myself, I remember the session, but I do not know what he means. What exactly happened? Is he testing me? Is he interested in my loyalty or my attunement? Either way, I feel apprehensive and on guard. He laughs and sighs, a kind of response that I feel conveys a sense of satisfaction and disappointment simultaneously. You don't remember, do you, huh? We always say in the end of the hour of our sessions that we will continue from where we left, but we never do that. So I say, you feel that I don't pay enough attention to you and I don't keep my promises. I don't really know. Either way, I was thinking a lot about the issues of self-punishment we discussed. Looking puzzled, as him conveying the message, what do you mean? You know, about all the instances in which I punish myself, all the issue about coming out, not taking the HIV test, engaging in unprotected sex. I know I could have solved this issue, but nonetheless, I still do not do that. I know that if I were to go and take the HIV test, I would have been less anxious about the possibility of contracting AIDS. And I know that not taking the test doesn't change anything about the reality of having or not having AIDS. And I know that not taking the test enhances my anxiety, but I still don't do nothing. I know that if I came out to my parents, I would have felt better and more freedom, but I still do not do that. I certainly know it's not okay for me to have unprotected sex, but I still do that. Being conscious about something doesn't make me, that doesn't mean I can stop doing it. It also happens with a betrayal in Oren. So I say, you are in a lot of conflict. Part of you feels you don't have the right to be free. You feel bound by anxiety, your parents, your date, and other parts of you starts realizing that you have the right to be autonomous. When the first part prevails, you feel as though you deserve punishment. I feel guilty about lying to my parents, so I punish myself and live like that. I know that if I had the courage to tell them, then some of these issues would have resolved themselves. I really hope there comes a moment when I will be able to do just that. You've gone a long way in accepting responsibility for your situation and feelings, but at the same time, you feel frustrated about not taking action, and this makes you feel angry and guilty. Speaking of angry, I was really mad at you the previous session. Really? I'm surprised. Angry at whom? Me? His parents? Himself? And Gil says, I felt you were cornering me, that you were telling me what we have to talk about, that we have to talk about it, and I really do not understand why. Why does it help talking about my guilt towards my parent? Either way, I'm not going to do anything about it in the near future. Maybe in a year or so, when I will move out of home. This is the way my mind thinks. Why talk about something if you cannot do anything about it? I really don't understand. I felt pressured in that spot, as if you implied that there was no other way of handling it. So I say, you felt I was trying to control you, that you have to comply with my agenda or else. And thinking, what does he want from me? I did not anticipate that reaction. What's with the attack? What did I do to him? I was just trying to connect him to his feelings, guilt, and shame. That's what we psychotherapists are supposed to do. Talk about unpleasant stuff, not say that we're not going to talk about them. Such an ingrate. Wait a minute, calm down. Maybe he makes a good point. What really happened here? What did I do to him? And he says to me, yes, as if there was no chance that what I was saying is true in any way. What's wrong about suppressing and avoiding hurtful stuff? I had the feeling you were trying to force yourself on me. And I noticed the reference to power relations as well as the sexual meanings. I suspect we are enacting a complementarity. But how to escape? How do we create a third in this suffocating complementarity? or that wasn't really my intention, and I can understand how you came to feel that way. These are very difficult and frustrating feelings to talk about, and I might have pushed you a bit too hard, and for that I apologize. If I try to think about the reasons for my behavior, about pushing you too hard, then I suppose maybe I once again failed by attributing you with the power and intensity, and that might have made me less sensitive to you. Now you can see the reason why I talked to you about the first enactments. And Gil says to me, "What's the thing with the power? I do not understand. I'm not special in any way. It's true that I have succeeded in several things, but I have also failed. What? Because of my size? And it's not only you. People are always saying that to me, that I'm very powerful and strong man. And this image of you fools them, as it did me several times. At the beginning, when I doubted that you needed therapy, with the depression period, and now with pushing you hard to talk about difficult things, not acknowledging how truly difficult it is for you. And this makes you feel alone, alone with the helplessness and vulnerability." Starts crying silently, says yes, a long pause. I stay silent. I really feel sorry for him. I feel guilty. I am such a lousy therapist. How insensitive can I be? You are disappointed in me. He says, "A bit. Not as much as the previous time with the depression. There was a whole month in which I wasn't feeling like myself, and everybody noticed it. My friends, people at work, and my family. And you didn't. Now, it's less important because it only happened between us and no other people were involved. And not only did I not see it, I thought you were strong enough to handle it alone. In the place where you needed me most, I left you alone. I feel I might be exaggerating with my guilt feelings and my identification with him. Maybe it's time to shift perspective." Gil, "It's not only you. It happens to me a lot of times. People feel that I am stronger than I really am. There might be something elusive about these changing Gils. In our previous session, we talked about your sensitive spot, the guilt, the punishment, the lies, and it was difficult to talk about these things. You felt vulnerable and hurt. So a different part of you, or maybe a different you, a different Gil rose to the front and defended the vulnerable Gil, the one saying that there is no use in talking about this stuff. There is a vulnerable Gil and a powerful protective Gil." And Gil says, "Aron was very sick in the last few days. They thought it might be pneumonia, but it turned out that it wasn't. I am really stressed about it. I don't really know what he has. What are you thinking about? You know, AIDS. I don't know if he tested himself or if he is going to test himself. We haven't really talked about it." He changed the subject, began being calmer, but now I see the anxiety raising. Was he preparing me to accept his vulnerable self? I feel a bit worried. Does he know anything about the sexual habits of the person he's dating? Did they have unprotected sex? We had sex even when we didn't have a condom, but I'm not that worried about it because the penetration act wasn't really long. We did more stuff, but the penetration itself was quite short. We understood we were doing something wrong, so we stopped quickly. I mean, I also have all sorts of ailments that bother me, but they pass quite quickly, except for the throat thing. This is something I have suffered for years, probably a genetic vulnerability. And I was sick, and they told me it was a virus or something like that, or maybe some emotional overload. It happened when I trained real hard. After that, I feel burning, and I measure my temperature, but it's never about 36.5. And I also have this fantasy that if it turns out that I am HIV carrier, my life will be different. I will leave the army. I love my job, but I also want to leave the army. I will probably be upset if that happened. I quite enjoy my position in the military, and my parents will have to know. What a twisted thought. To want to contract AIDS just that I will not have to deal with coming out to my parents. But I do not intend to take the test or come out to them. You probably think I should take the test, don't you? Don't you have anything to say? After this long monologue, I can sense his anxiety, the pressured speech, the somatic preoccupation. I feel anxious about him, and I sense his anxiety. But I notice that the tone of voice is angry and not anxious. I feel connected. I can finally feel compassion and empathy towards him. I smile sadly and compassionately and say, "It must be awful to walk around with all this anxiety." The psychiatrist in me wakes up. Should I suggest medications? Am I avoiding the feeling of anxiety by doing that? Am I providing a good treatment if I do not suggest? Am I reenacting the depression scene all over again? I decided to stay with psychotherapy for now. Gil nods in agreement, silent. In most cases, you keep face about your anxiety and deal with it alone. But today, you allowed me to witness and feel the anxiety together with you, still silent. There was something interesting about the way you shared your anxious thoughts and feelings with me today, your tone. It was an angry tone, right? And I think the anger you expressed towards me allowed you to bring your anxiety to the room, to talk about it, to experience it, and to let me experience it as well, but not by feeling pity and shameful. There is some truth in what you're saying. You allowed me to witness your anxiety, but also kept your powerful position. You allowed yourself to be both anxious and in control, to talk about the fear of breaking down, but keeping yourself whole nonetheless. That's true. Even though this kind of experience is not easy for you and me. For you? Yes, you know me pretty well already, and you know how much I enjoy our intellectual talks and debates, and we have some wonderful sessions in that regard. It's a lot easier to experience anxiety, to experience that than anxiety and fear of breakdown. But I am really glad you allowed me to be with you in this moment. Really? Because I don't feel any different. There were things I found much more difficult to talk about, like being attracted to you and having sexual fantasies. And maybe you're still mad at me. Because even though you come here to feel better, in a lot of cases you only feel more pain. I hurt you in many instances. I think that I somehow need to tell him that in a couple of months I will be taking a maternity leave for about half a year. Does he know? Does he sense it? How can I do that to him? I know how sensitive he is. Yes, and this is exactly why I was so mad at you for forcing me to talk about things I didn't want to talk about. I can understand that your motives are good, that you're trying to help me, but still, a lot of times I don't understand why we have to. Sighing as I usually do at the end of a session, we nod in acceptance for termination. We will meet next week. I smile at Gil as he leaves the room.